Morning, everybody. Good morning. Happy Monday. Good to see everybody back on board. Happy guys show up, especially in a Monday morning. It's good stuff. I'm happy. I'm happy. Dedication, motivation, discipline, routine, right? That's what we do. That's what we have to do. So I thank you all for jumping on. Hope you all had a wonderful weekend. Hope you guys had a wonderful, wonderful weekend. Moving forward, like I mentioned before, anything you guys need, especially when it comes to assessment, right? You're taking an assessment, whether it's a school assessment, the school is scheduling you for assessment, or you have to take one on your own. Remember one thing. If you haven't been doing timed questions, if you haven't been practicing timed questions, sets of 40 questions, please be cautious and careful. Get to actually doing an assessment. You're eager, taking an BME, think one thing. If you haven't been practicing time, simulation, multiple blocks, at least 40 questions, to walk in and do an assessment test, which is time, and there's 50 questions, block will be very, very challenging. And you might think it's makes sense. I think it makes sense. But when we study, focus, we have the blinds up, we're just studying. We sometimes assume we might be able to perform. And then when you don't do well, being a student, people get nervous. So I advise you all, if you are ready, getting ready to take an assessment test of any sorts, practice before you go. You can't run 5K, can't run a marathon, can't run 2 miles back to back. It's the same concept. So I find myself saying this very often to a lot of people because I know we're all eager to move forward, but it's challenging. So if you're getting ready to take a school assessment or you just want to assess yourself, try to get to 20 questions timed and to get to 40. See how you attack, see how you perform with these stressful situations, and then move forward. All right. So that's that. Also need feedback from you all. Just email me, send your reports, let me know where you're at, how well you're doing, scores. I need to see statistics as far as why you're getting it correct, still incorrect. Immunology is a wonderful topic for us to really leverage. That's why I do it every Monday morning, because I can't focus and condense all of medical school in a couple of weeks, nor would I, nor would I want to, nor should you. I know schools do what they can to teach, no problem. It's up to us to see what we know and what we don't. Right? So that's why we have these sessions twice a day, morning and afternoon, to have doctors jump on and see what you know. Everyone here is on a different stage, different level. Some may be similar. Step one, step two, study for an exam, for an assessment test. So no matter how much you're studying, you have to understand going in to take an assessment, they're going to have you time. So prepare as you're studying daily. I know it's not easy. You have to check if you have endurance and stamina. If you don't have endurance and stamina, your performance will be influenced. And fortunately, won't be as high a score that you. All right. So think of immunology, right? Immunology, we have many, many different topics within immuno. We've done many before. We do it every Monday, whether it's vaccinations, whether it's transplants, whether it's hypersensitivity reactions, whether it's congenital immunodeficiency disorders, right? Whether it's B cell, T cell, B and T cell. These are details that I've done with you every Monday that I'm confident that if you're with me for at least a month or so, you've seen it over and over. Seeing it is different than recalling, right? It's familiar, Dr. Stavros. I've seen it. Hey, when you're under pressure to answer the question, can you or can't you? Right? That's where we're focused. We are doing our very best to A, understand the material, B, try to recall it, apply it the best we can, review it often. So when you don't take the exam, whether it's step one, step two, shelf exams, everything comes together, right? If you can practice and implement reviewing often, whether it's every day, multiple times a day, every other day, at least on the weekends, that will then transition and help you be better with shelf exams better with your step 2, better with your step 3, and so on. So when I ask you all, what do you think the points are? This is for all of you to think about. You need to think this way, unfortunately, because step 1 is more of a test-taking game than anything else. Yes, you need to know content, of course. You're not walking in from undergrad, you're coming to me with a medical school background, whether you are currently in medical school, finished medical school, maybe a couple of years ago you finished, either way, you're all in medicine. So I expect you've seen it somehow. Problem though is you need to get points to pass, right? We want a high pass. Clearly, the more information you know, and the higher you score, even though it's a pass or fail, we'll then transition over to next stage. But when I ask you all, do you know the points? Do you know where you have to focus on? That's most important. So when I ask you, always think, okay, well, I know my hypersensitivity reactions. I know my vaccinations, maybe live versus dead. Maybe I know them. Transplants we've done very often. I know B cells and T cells and B and T cells. This is how you improve your knowledge, whether it's immunology, whether we're doing micro on Wednesdays, right? We do micro Wednesdays, whether we're touching biochem. So if you just look back and say, well, I have all these systems to cover, not cover everything in a short time frame, it's impossible. But if you say, well, we've done organ systems twice in a month, each one twice. I've shown you where you can leverage post the exam. It's up to you though to say, well, can I remember it? Can I recall it? Can I apply? All right. So we have multiple immunology questions today, a set of 13 questions that I chose for you all. Every Monday, there are different sets of questions. Now, if you're with me more than 2-3 months, clearly you might see some pop up over again because there's a finite number of questions per top system. That being said, if you do know the question, just typing in the answer isn't enough. It's not impressive. It shouldn't be impressive, right? You know the answer. You've seen the question. You've seen the case. What you should do next is review all the other answers. Trust me when I say this. Seeing the case after a couple of times, it's like, all right, well, you know the answer. Get it. But do you know the other answers? So that's why when we're all here, we're not doing one-on-one, we do one-on-many, right? We're here as a community. So some of you might know it, some of you might not. And this is where for me to feel comfortable that this is working, because it is working. I quiz everybody every day. So whether you know all the answers, good. Whether you don't know the answers, get to know them, right? This is where the points are there for you to take. All right, raise your hands up high because I need you all to try to participate, whether you want to jump on live, like a lot of doctors do here, versus on the back end, type away on the keyboard or phone, laptop, or iPad access today. So raise your hands up high. I see doctors on the East Coast, West Coast. Good morning, good morning. Good to see you all. From California to New York, some Midwest. We have immunology. Raise your hands, guys. We got to do a couple of questions. I'm not doing it. I've done them before. Dr. Singh, God bless you. Jump on board. How are you?
Good morning. Good. How are you?
Good. 6 o'clock a.m. Right? No, 6 a.m., isn't it?
Yep.
Question. Are you sleeping well every day?
I'm still working on that, but
Okay.
it's getting better.
The reason I'm asking, and again, guys, you might think, why is he asking if she's sleeping? There's many doctors I work with. They sleep, they stay up late, they study late, like I used to. Problem is, you got to get back on schedule, right? So at least you're waking up at 6 a.m. That's awesome. How do you feel about immunology? Meaning, are you feeling more comfortable? Points, questions, where you can use to leverage yourself?
Yeah, I feel like I'm getting more comfortable with immunology the more I repeat it. Like it's the repetitiveness that's been helping me with immunology. So I have seen improvements with that. So I'm happy about it.
Awesome. Um, I mean, big question before we go. How are the other, like for example, organ systems? Because I know you're hitting it hard every day.
Other organ systems, I'm definitely working on it. I feel like since I'm now starting to do more timed questions, I'm noticing myself rushing through it and I'm getting to two answer choices, one right, one wrong. And because of the timing, I end up like not fully thinking through it and then choosing the wrong one. So I'm working on fixing that issue.
Okay. Why I asked instead of just jumping into questions immediately is because I can't spend time answering 50 different people same answer. Meaning, I know most of you have the same issue. Not here now, but overall, as a student, we all have that issue. So,
Mhm.
what I would suggest, and this could resonate with all of you here, if you don't go to 40, try to do 10 questions time. If you can do 10 time, then you can transition or graduate to 15 to then increase by increments of 5. Okay. If you're doing 20 questions time and you're seeing that you're losing the last 4 or 5 questions, anything we do here is worthless. Anything we're doing here now is not going to save you on exam. So that's
Mhm.
actually very important to bring up. If you need to pace yourself, because if you do not, walking into the hospital with seconds, not minutes, looking at the patient, rushing with a differential, moving on, you're not going to pass. It's just not going to happen, right? You're not going to do well. So if you're rushing, go back and say, what exactly is the cause? So then you start doing 10 questions time, then 15 and 20, and keep moving. It's a practice. You can't do 20 to 40 just like that, right? So
Mhm.
try your hardest. Talk to me. Let me know. We'll meet up this week one-on-one to then see what we do. But this is the only way you can improve. It's just by literally practicing. You have to read. You have to read the last 2 or 3 lines, the whole scenario. And if you read the last 3 lines and it gives it to you, take it and move. Don't read the case. Meaning, if you 100% and confident that the answer is in that you have the answer, right? You don't want to just skip around. But try that for me, okay? And let me know how that goes.
Okay.
Okay.
All
Awesome.
right.
And anybody else who has the same issue, think about that. Set 10 questions time, then 15, then 20, and really want to get to 40. Because if you do focused questions, that's also different than mixed questions. If you're doing questions in immuno, well, your mind is in immuno. Do a mixed block of 20 and it's everything. You're like, oh, my score drops because my mind is everything. You have to day. That doesn't happen. All right. So hope that helped. Let's attack a few questions. Let's say 2 or 3, and then Nicole's gonna jump on and do a few. All right,
Okay.
let's attack. Go.
All right. Examination shows decreased breath sounds over the lung fields and bilateral purulent otorrhea. His palatine tonsils and adenoids are hypoplastic. Um, Quantitative flow cytometry of his blood shows decreased levels of cells that express CD19, CD20, CD21, so B cells, basically.
Okay.
Which of the following is the most likely cause of this patient's condition? All
You see
right.
how awesome that was? You saw a CD count, and you're like, oh, I know what that is. That's important, right?
Mhm.
So, for the top 2 seconds, read the first two, highlight what you see, and confirm exactly.
Okay. 2-year-old boy is brought to the emergency department because of fever, cough, and ear pain over the past 2 days. He has recurrent respiratory tract infections and several episodes of giardiasis and viral gastroenteritis since he was 6 months of age. So with giardiasis, I'm thinking IgA,
Right?
so like IgA deficiency.
Okay. See it
Um,
here.
I'm also thinking maybe it could be Bruton's, because
Oh,
Bruton's is,
that.
huh?
What I'm saying, good. I cut you off. What are you saying?
I'm also kind of leaning towards Bruton's as well because of the CD count
Okay.
expressions being low.
So you see that you have the CD count, it's B cells, and there's
Yeah.
3 types of B cell disorders, right? That we think about,
Yeah.
which are what again?
It's Bruton's, IgA, and the CVID.
CVID. So that's a quick little ABC, quick little way to remember 3 to give a category. Now, you see that you might think it's IgA deficiency because you're like, oh, a second, I see joint infections, I see psoriasis, I see all that stuff.